Hey, good evening. So tonight I'm going to talk to you about orthopedic surgery, mental health, and the role of the orthopedic surgeon. And I'm going to use the analogy of a car. So basically, your car is like your body. Your mind is the driver, and your orthopedic surgeon is the mechanic. So if your car breaks down, you take your car to the mechanic. You want it fixed. Your mechanic is the technician. If you're in an accident, you want your car back on the road, they're likely not going to discuss with you why you got in the accident. Were you driving fast? Were you drinking and driving? Were you texting and driving? What was the problem? They're not going to get into that. If your car breaks down because you weren't doing maintenance, they might just fix the car. Maybe they'll say something about you could have avoided this with more maintenance because they're a technician. That's not their job. They didn't get into it to be a philosopher. Your orthopedic surgeon is very much like a technician. When they were in medical school, they got interested in orthopedic surgery, likely because they were interested in the surgeries and the technical part of the job. So when you break down because you haven't been doing your maintenance, they may not talk to you about this. They might just fix the problem. So the issue is some people go to the orthopedic surgeon if they see him like in a trauma center or an emergency room because they had an accident. And sometimes it's just bad luck, but sometimes it's risky behavior that could have been avoided. Your orthopedic surgeon is probably not going to be the person who discusses with you how to avoid that risky behavior. But now we see a lot of people who are coming in year after year with problems of chronic inflammation. So this means like the arthritis, the tendonitis, the bursitis, those kind of things. And we do start to notice that these problems stack up. So more and more physicians, but also orthopedic surgeons, are interested in helping their patients avoid needing to see the orthopedic surgeon all the time. So that's why many physicians are starting to speak more about diet, exercise, sleep, stress reduction techniques, and all those things. But the one thing is the orthopedic surgeon, because they're more of a technician, they're probably the doctor that's the least likely to do this. So you need to be honest with your orthopedic surgeon. So if you are too heavy for a joint replacement and you need to lose weight, your orthopedic surgeon might just say, hey, you need to eat better and you need to start exercising. Or if you're coming in with problems of chronic inflammation year after year, they might say, hey, you know what, you need to eat better, you need to exercise more. But there might be an underlying mental issue that you have. That's the reason why you can't do that. So it's very easy to say you need to eat better, but if you are using food as a distraction from maybe anxiety or depression or something else in your life, it's not helpful to just have your orthopedic surgeon say you need to eat better. So you need to know for yourself that you might need to get help with that underlying disorder. And even admitting to your orthopedic surgeon, be like, yeah, I really struggle with eating well. And then maybe your orthopedic surgeon can give you some guidance. Maybe not. Maybe all they can do is say, hey, discuss this with your primary care doctor or discuss this with a nutritionist, something like that. And it's the same thing with exercise. We all know that exercise is likely the number one treatment for depression. It's a great treatment for anxiety. We all know that it helps. The problem is if you're too depressed to start exercising or you're too anxious to start exercising, it doesn't help to have somebody say, hey, you need to start exercising. And if that's the issue, you need to communicate that with your orthopedic surgeon so that together you can come up with a plan. And sometimes your orthopedic surgeon is not going to be the most interested person in that plan, but maybe they can refer you to the right place. So your mental health has a lot to do with how your body performs, and you're going to end up having problems. And I often say that the orthopedic problem is often the check engine light. So a lot of the major problems that we have in our body are related to chronic inflammation. And this is like heart disease, cancer, diabetes, obesity, things that are real problems. They tend to be silent killers. The orthopedic problems, the tendinitises, the bursitis, the injury that should be better in 2 days and takes 2 months to get better, those are all problems of chronic inflammation that because of pain, they notify the patient. So they are the check engine light. So a lot of problems in life are due to chronic inflammation, and they're due to lifestyle, and you end up in the orthopedic surgeon's office. We all know this, but what we don't know is the link between the mind and the body. And a lot of these problems are because we don't exercise, we don't eat well. And why don't we exercise or eat well? Well, a lot of times it's because we have an underlying mind issue, basically a mental issue. And it's because of anxiety, depression, things like that, where people aren't really able to eat healthy. Like they know what they're supposed to eat and they can't do it because they're using food to cover for these other issues. They know they're supposed to exercise, they can't do it because if you're depressed, you're too depressed to go out and walk and sprint and lift weights and do yoga and all these things you should do. So it's just something really to keep in mind that the mind and the body, they both need to heal if you're ultimately going to heal. And that is also one of the problems for kind of the roller coaster of health that a lot of people have is they start making improvements, but the next time they have a challenging event in their life, they go off the rails. So this means they stop exercising or they stop eating well. And the reason is because they can start using eating well and exercising as a distraction from their problem instead of really addressing the problem. Once you address the underlying problem, whatever the mental health issue is, if you go to that first and address that, and I urge you to discuss it with your doctor, whether it's an orthopedic surgeon, your primary care doctor, a therapist, anybody you can find. If you address that underlying problem, the rest will fall into place. As you make your mental health better, you will start eating better, you will start exercising, you'll start having less injuries, you'll start having less problems. So just consider that. It's you have to do the maintenance on your car, but if the driver's not in a good place, you won't do well there. And just remember, your orthopedic surgeon, it's not their natural habitat. They're like a mechanic. They're just going in to fix you. But maybe if you prompt them a little bit and just be honest with them and say, hey, I know I'm supposed to lose a bunch of weight for my knee replacement, or I know that I wouldn't be having all these orthopedic problems if I could control my chronic inflammation. If you just give them the full picture of why you can't do that, then maybe they can even help you. Good luck.